I was inspired to start Heart Care International after having been invited to China to lecture and to perform heart surgery. I returned from that visit and lectured in the United States, and one of the attendees of my lecture came up to me afterwards and asked me if I would help him bring patients from Guatemala to the United States. In examining this and thinking about it very seriously, I learned that it would be really a monumental task in order to do this. The logistics, the expense, the encumbered expense and manpower resources that my hospital would have to put in just seemed too formidable. So we thought perhaps it would be better to take a team to Guatemala and perform heart surgery there. And that's exactly what we did in October of 1994. We took a team of 25 people to that country and operated on about 25 children. It went extraordinarily well. It was a wonderful learning experience and a very gratifying experience for all the team members. After returning from that trip to Guatemala City, I thought that that was perhaps the end of it. It was logistically complicated. It took hours of time, of thought, and preparation. We had to transport nearly 10,000 pounds of equipment to Guatemala. And then I began receiving the telephone calls. First it was from team members who had been on the trip. Then it was on medical personnel who wanted to know when the next trip was. And then the calls started coming in from Guatemala. And that's when I realized that we needed to do something. And there's where we began with Heart Care International's wonderful legacy of now 18 years of service in Central and Latin America.